Alterations in reproduction, pathophysiology, and management. Although the reproductive systems are formed during the embryonic stage of life, they're not functional until puberty. It's at this time that an individual will begin sexual maturity and develops the gender-specific characteristics and ability to reproduce. The external structures on the female includes the mons pubis, which is the pad of fat at the area where the pubic bone is, and it's covered with hair. The vulva, which is the external genitalia. The labia majora and minora are skin folds that cover the urethra and vaginal openings. The clitoris, which is erectile tissue that's stimulated during sexual intercourse. The Bartholin's glands, or bulbourethral glands, which are located on either side of the vaginal opening, and this provides lubrication for sexual intercourse. The fourchette, which is the area behind the vaginal opening, and trauma to this area often provides forensic evidence in rape trials. And the hymen, which is a mucosal opening of the vagina. Perforation by physical activity, insertion of a tampon, pelvic examination, or sexual intercourse can actually cause tearing of that mucosal opening. Internal structures include the vagina, which is a tube-shaped structure that extends to the uterus, and it will accept the penis during a sexual intercourse, and is also the passageway for the infant to descend from the uterus during birth. The uterus is the organ that provides protection for and a place in which an embryo grows throughout the gestational period. Two fallopian tubes are structures in which a mature ovum passes to the uterus on a monthly cycle. It's also the area where the ovum is most commonly fertilized. And then two ovaries, which are also known as the female gonads. They secrete estrogen and progesterone, and they house thousands of oocytes that are present on birth. These are also called developing egg cells. Ovulation is the releasing of an ovum from the ovary each month. The follicle-stimulating hormone will initiate ovulation, while the luteinizing hormone will cause the release of the ovum from the ovary. And then the corpus luteum surrounds that ovum, and it secretes estrogen and progesterone. Pregnancy will occur when the ovum is fertilized by a spermatozoon. The fertilized ovum will then be referred to as a zygote, and it attaches or implants in the endometrium tissue of the uterus. FSH production will stop during pregnancy, so no additional ovulation will occur until after delivery of the uterine contents. Menstruation will occur when the ovum is unfertilized. The endometrium will then degenerate and shed, and this is what causes the bleeding, and it occurs about 2 weeks after ovulation. Normal loss of blood amounts are usually about 30 to 60 mLs. There is a lack of body fat that can cause variations in the cycle. In other words, if a woman does not have much body fat, she may have infrequent menstruation periods. So true or false? The hymen can be perforated in more ways than sexual intercourse. And this is true. So true or false? Normal menstrual flow measures between 30 and 60 mLs. Again, this is true. So when assessing the female client, we need a general and family history. We need to know when menarche was, in other words, the very first menstrual period they had, the last menstrual period, and what their usual menstrual pattern is like. We need to know their sexually transmitted infection risk. Have they had pregnancies, abortions? Do they use contraceptives? Have they reached menopause? If so, when? Are they on any hormonal replacement therapy? We need to potentially treat breast examinations or teach breast examinations in addition to doing a clinical examination. Determine if there's any prior treatments or surgeries. Are they on any drugs? Do they have allergies, any substance abuse or smoking? And what are the symptoms of the present disorder? A gynecological examination, also known as a pelvic examination, will be done to examine the reproductive structures. Diagnostic tests for the female will include cytologic tests for cervical cancer, such as the Pap smear, and this will obtain a sample of exfoliated cells that's removed by scraping or brushing the tissue. The American Cancer Society recommendations on the initial and subsequent Pap tests are included in your book, and client needs to be appropriately prepared for this procedure. We may also do a cervical biopsy, which would include a conization, endometrial smears or biopsies, a dilatation and curage, also known as a D&C, which scrapes the interior of the uterus, endoscopic examination, such as a colposcopy, laparoscopy, or colposcopy. We can do a hysterosalpingogram, an abdominal ultrasound or sonogram. Lab tests may include a CBC, electrolytes, total urine estrogen, or pregnancy test, and culture and sensitivity if infection is suspected. The female breasts are defined as mammary glands or modified sweat glands. We have the areola, nipple, and lymph nodes. Their primary function is lactation. They are influenced by hormones. Estrogen will cause growth of the female breast and assist in the transport of breast milk. Prolactin promotes the production of breast milk, and progesterone secretes the milk. Breast examination techniques will observe for size, symmetry, unusual changes in the skin and nipples. Breast self-examinations will facilitate early diagnosis and treatment, although there's no clear evidence or it's just had a very small role in detecting breast cancers. Occasional exams are important, though, for a client to learn their body so they're able to note and report any changes. And it's important for men as well because men also can have breast cancer. So it would require teaching for appropriate techniques. Mammography is the gold standard for detecting breast cysts or tumors, and it does provide breast cancer detection. Excuse me. The recommendation prior to 40 years are individual choices, and that does continue through 40 to 49 years. 50 to 74 years, it's recommended that women have a mammography every 2 years. And after 75 years or older, there are no recommendations. We do use a cushioning pad to help reduce discomfort, though. Ultrasonography can be used with the mammogram and will help differentiate fluid-filled cysts from other types of breast lesions. A breast biopsy can include an incisional biopsy, an excisional biopsy, an aspirational biopsy, and nursing management will involve teaching on the procedures and discomforts, post-procedure care and symptoms to report, in addition to emotional support, potential results and diagnoses, and what to do when those results have been revealed. So true or false? Weekly breast self-examination is important for breast health. And this is false. With the male reproductive anatomy and physiology, the external structures include the penis, which contains the urethra, and this is where the urine and sperm both pass. It does contain erectile tissue on the top and bottom. The glans, which is the tip of the penis, the prepuce, which is the foreskin that normally covers the glans, except in circumcised males, and the scrotum, which is a divided sac of skin that contains the right and left testes. Internal structures include the testes, seminiferous tubules, epididymis, ductus deferens, and spermatic cord. The testes are the male gonads, and they cannot produce viable sperm when the temperature is at or above body temperature. In other words, it cannot be too hot. The testes produce sperm and secrete testosterone, which is referred to as spermatogenesis. Spermatogenesis is stimulated by the follicle-stimulating hormone, or FSH, and testosterone secretion is controlled by the luteinizing hormone. The male hormone is testosterone, and it affects the development and maintenance of secondary male characteristics. The amount of testosterone and sperm production will decrease with age, but a male can reproduce throughout his lifetime. Sperm will form within the seminiferous tubules, and the epididymis will store the sperm until it matures. The vas deferens is the tube in which the sperm travels to the urethra. Accessory structures in the male include seminal vesicles, prostate gland, and bulbourethral glands. The seminal vesicles are glands that produce fluid to nourish the sperm. They assist in sperm motility, stimulate uterine contraction to help propel the sperm to the ovum, and prevent destruction by female antibodies. The prostate gland will encircle the urethra, and it also produces an alkaline fluid. The gland enlarges with age. The bulbourethral glands will secrete mucus to help lubricate the glands of the penis. Erection is the process in which the penis becomes elongated and rigid, and it assists in penetration during sexual intercourse. It's caused by dilation of the penile arteries and engorgement of blood within the tissues. Emission will be the movement of sperm and fluid into the urethra, and ejaculation is the forceful discharge of semen from the penis. Normal ejaculate volume will be 2 to 6 mLs, with an average sperm count of 400 million. Infertility is a sperm count of fewer than 20 million spermatozoa per milliliter. And the absolute refractory period from one erection to another can be a few minutes to a few hours. Assessment of the male will include obtaining a good history from the client, what the family history is, and what their sexual history is. This will help determine sexually transmitted infection risk, helps us learn about contraceptive use, any concerns, and if there's any issues with sexual activity with erection or ejaculation, and determine if there's any prior treatments to the genitourinary system, and if there have been, what are any genitourinary symptoms. Physically would require an assessment, inspection, and palpation of the external genitalia. Transillumination can assist with this, and a digital rectal examination to examine the prostate. Diagnostic tests include a transrectal ultrasonography, cystoscopy, tissue biopsy, cultures, fertility tests, and tumor markers, which would include a PSA, which is a blood test that can help detect prostate cancer in addition to other blood tests.